Hi guys! In today's video, we are going to talk about yoga. We're also going to see if the studies are true about doing one 15-minute session of yoga and then having a calm peace of mind. There's studies all over saying it's true. I've read 3 peer-reviewed journals this week and a book about it, and I tried it. So if you want to know if yoga is something that you can use to make you feel better, help you on your neuroplasticity journey like me, help you with depression, anxiety, just make better decisions, it's coming up. Do a little review. First, the facts. I went through all my old nursing books to see what I had been taught previously about yoga. I found a paragraph, and it's only a paragraph, and it's yoga has been found to improve wellness and prevent disorders such as depression. So the point I want to get to is that in the Western culture, we have been taught to go strictly to, well, you try exercise. If it doesn't get better, then you may change your environment. But if you go to the doctor and you tell them about your mood, you're feeling this kind of way, they're going to give you antidepressant. And that can be verified from this book. This is my pharmacology book from nurse practitioner school. So what you would do is you would assess the patient. You might talk to some friends, family, anybody who wants to give input or concerned about their family member. See what they've tried before. If it's not working, they're going to give you a SSRI, and they're going to give you, and they're going to tell you that it's not. The tea for today, I would like to call it anti-stop smoking tea. Sorry about that, my son knocked over the camera. Here we go. Put that one to the side. And in nurse practitioner school, in treating a person with depression or ongoing anxiety and issues, you would find out, going on their complaints, if it was a anxiety, then you would do a benzo, such as maybe a Valium or something. If you were just a mood stabilizer, then it would be like a buspirone, and what they call it is a SSRI. And they'll tell you that it's going to take about 5 weeks before you see some effects on it, That's it. Depending on if it works or not, they'll give you something else. Yeah, you got an acute treatment phase, then the doctor will come back and they'll tell you, or the patient back and they'll tell you, or the patient, if this is working. If it's not working, they're going to give you something else, or they're going to modify it. Then you got to continue on, and then you have a maintenance phase. So in Western, we don't just go straight to yoga. We're going to the book, the drugs. Yes. Yeah. So, another book, Drug Therapy, is like I said, you have benzos, hydroxyns, and trazodones. It's a long list of medications that you could give to a person. Now, don't get me wrong. Some people need their medicine. Okay? But when I was researching it in Asia and in Chinese, they have one treatment, just one. Watch this.
The group that had gone through the yoga had a significantly improved scores on their depression, and not only significantly improved, but actually their likelihood of remitting, which means having no sign of depression, was actually much higher than those that were in the control group. So
get into the medications or herbal therapy, we need to see what we could do for ourselves when we get anxiety or provoking moment or a stressed event, because what we're trying to do is counteract the body's fight or flight. You know, we get anxious and then we're acting like we're getting chased by a lion, but we need something that we can do right then, right there, to calm down and learn how to master our emotions. So that's what yoga's about. So I researched it. I'll leave all the articles. I've read 2 or 3 case studies, and then I got this journal in the mail. Boom. And it is the Journal of Holistic Nursing, and it had a study about nurse burnout and the effects of yoga. They did six weeks, and it was ages 35 through 40, all nationalities. Some of them did it, some of it didn't. And guess what? It said that they felt better. They were less stressful. They were less stressed, and they could speak with their patients naturally, or they wanted their patients to feel the calmness that they felt. So that's awesome. So I set out on a journey to do it. After my morning prayer, I walked to the kitchen, I lit a candle, and I cut on YouTube University. Everybody knows right now I am broke. So I don't have, I just can't go get anybody. So YouTube University, yoga for beginners. And let me tell you that, well, disclaimer, I didn't know what I was doing. I tripped, I fell, I did a whole lot of movements that probably weren't even in there, but I stuck with it. And they tell you to control, pay attention to your body, and feel your feet, your arms, and all of this stuff. And it was kind of weird listening and trying to do it, but I say about the 8-minute mark, I think I felt like I could pay attention. I could pay attention. Now, the first day wasn't so wonderful, but day 2 and 3, I got better at it, and I felt accomplished after. So I'm willing to say that I think yoga would be a good thing. So maybe all of this stuff is playing out like it should, and I shouldn't just want to be on any medications. Well, I don't have any insurance, so that's a good thing. If you don't have any insurance, this is something that you can teach yourself, your friends, or somebody. Do yoga. Those yogis back then, those Buddha guys, I got a Buddha, but I didn't get a Buddha for that. I didn't know, but it works. It works. Now, if you pair the statistics from United States or Western over here to Asia and other countries, hold on, I'm going to show you. Look at their rates to see. So it does work. So that's it. I am putting yoga in my routine. Why not? So we'll keep going through and we'll see how it works out. But yes, yoga, it works. Another thing is, they say that yoga, as soon as you do a session, that it increases your GABA, which are neurotransmitters in your brain for mood. So you can buy GABA online, or you can get a drug for GABA, or you could do yoga. if you can't tell, I am in a good mood. So hopefully it sticks and it stays. So GABA. GABA is a neurotransmitter that increases the mood in your brain.